Buenas tardes, estamos en el precurso de Bausch & Lomb en el José Berrocal Auditorio, en el Bascom Palmer Eye Institute, y tenemos el privilegio de estar con el doctor Henrique Melo, Professor of Infectology and Medicine, and Intensive Medicine, in the Medical University of Unionville, Coordinator of the Hospital and Infectology Commission, and he's in the control of Doña Elena Hospital and Unimed in el Hospital Central in Brazil. Dr. Melo, thank you for being with us today. Can you talk to us a little bit about how infectology concepts can be applied to the ophthalmology practice nowadays?
The concept is the same. What we have now is different kind of bacteria and resistance, making the choose of drugs more harder. Then you must think in some concepts that ophthalmologists don't use in a common way. Then we must talk about some concepts about resistance and the best way to choose antibiotics in a world with resistance and a little bit options. This concept is now in our conferences in infectious disease. We call this stewardship, antibiotic stewardship, or the way we manage the resistance with the new drugs and the old drugs.
So how much has bacterial resistance impacted your practice?
In infectious disease, we always have resistance. Okay. What is the scenario today in the world, and mainly in ophthalmology? You have bugs that are resistant, and because in ophthalmology it's hard to make cultures, the ophthalmologists don't see it very frequently as we see in hospitals, and then makes the doctors comfortable with the drugs they have. But when they look at the publications, they find a lot of resistance and little options. Mainly we have in ophthalmology to use topical 3 classes of antibiotics. And for the most important one, fluoroquinolones, the quinolones, the 3rd and 4th generation of quinolones, the gram-positive bugs almost are 50 to 85% resistance, and this is a very huge problem. Then we talk about what we have, and after that the ophthalmologists talk about the new options about basifloxacin and what this new drug could help doctors in this scenario of resistance.
So the role of quinolones has changed?
Yes, of course. We have. This is the mainly drug used by ophthalmologists, and because that the bugs gets resistance, and we need to change the way we use or use new drugs. Okay. This is the mainly objective of this conference today.
Okay. Give us some of the highlights of your presentation.
I will talk a little bit of everything. I initiate with the history of resistance, starting with the 4 billion years ago when the Earth was made, and passed through the history and goes to Fleming with penicillin, and starts with what's happened since the 2000 from there. And we have a lot of resistance and a lot of publications. What you have with the resistance mainly in ophthalmology, and we ended with pharmacology concepts where you use the drugs you have, the best way to use it, optimizing the use to have the best results. I think in the resume is what I intend to talk about later.
Well, thank you so much, Dr. Melo. We look forward to your presentation.